On this episode of the podcast, I have with me Prashanth Sarpamale. He is the CEO of Althea.ai. We're going to be talking about a couple of things. We're going to be talking about analytics, his healthcare analytics in detail, obviously, but also the transition from having a role in the technology side. He was a chief data analytics officer, and now he's the CEO. And a lot of people want to know how that journey goes. So he has some great insight he'll share with us. Prashanth, thanks for being on the show.
Yeah, absolutely. Thanks for inviting me, Amir. Really excited to be here and share my thoughts with your audience.
Awesome. Yeah, thank you. So before we start, you're the CEO of Althea.ai. Just if you could tell everyone what Althea.ai does, just at a high level.
Absolutely. So Althea really focuses on integrating health equity with patient engagement and closing care gaps. That's what the company does. So obviously, we have focused deeply in healthcare analytics. And what we really do is try and identify in a very analytic fashion by deploying AI methodology, what are the gaps from a social determinants of health perspective at an individual patient level. And therefore, what is the impact of those gaps on patient health, and how we can leverage data and analytics to actually bring that insight into treatment plans and close it. So that's really what we are working on. It's a very hot sector as of the moment, both from a CMS or from a government perspective, as well as a lot of the industry is really looking to find out what can we sort of leverage beyond pure clinical and medical factors to understand what behavioral, what social factors really drive clinical outcomes. So that's a fascinating field for us to be in, and how to sort of drive data and analytics to drive health outcomes is something I've always been interested in.
Awesome. Yeah, it's a hot space. Over the last couple of years, we've seen a lot of analytics being applied in healthcare. And I guess for everyone to understand, so obviously when we think about analytics, there might be some assumptions made of what it is, what it isn't. When it comes to healthcare analytics and the way you're describing, let's say what Althea does, a lot of companies that are trying to apply some machine learning on top of some type of healthcare data, payer insurance data. What are those companies trying to do? How are they trying to help the patient? Because it sounds great, like in terms of, we're going to help the patient, but what are the dots that we're trying to connect so that the healthcare does and the patient care improves?
Yeah, so all of healthcare is sort of focused on three things. The first one is to improve clinical outcomes. The second is to improve the quality of care. And the third is to improve the cost at which you deliver the care. And obviously, while doing all of this, core component is how to improve the experience of receiving that care from a patient perspective. So this is what all of healthcare is trying to solve. And all the data, the insights, the analytics sort of goes towards supporting these aims, right? Now, from a healthcare perspective, one of the primary challenges is a lot of this data, which is associated with an individual patient, might be dispersed across the system. How you get that data together and drive a unified view of insights into that data is a consistent challenge that has plagued the healthcare sector, right? So as an individual patient, as a person receiving care, how can you ensure that your care team has all the data that they require to make the effective decisions to improve your health outcomes is something that deeply concerns every person out there. So, that's what healthcare analytics is really, really trying to solve. That's the tip of the spear.
And I guess as you're kind of looking at, it's evolved, it's getting progressively more technical. It's getting, so we're seeing a lot of AI and ML come into play, and you're starting to see some of those technologies sit underneath data, chief data analytics officer. Are you seeing that role transform from the traditional, well, we do a lot of reporting, we answer questions, so now we're forward thinking. We need to start, looking at the universe of data compared to individuals and start to drive some of those, things that potentially AI and machine learning can anticipate.
Absolutely. And, the role of data in enterprise has transformed to becoming much more of a revenue as well as bottom line enabling function. And especially in healthcare, if you look at it, first of all, you're trying to identify the people for whom you should be assuming risk, right? As a payer, as an insurance company. That's an analytical function. The better you can get at understanding the underlying risk for a particular cohort of patients, then the better you can sort of target all the capabilities you have at hand. The second is, as I said, how do you get all the data together, spread for these patients from across the system, from hospitals, from insurance companies, from laboratories, from pharma companies? How do you really get it together and drive insight into that? That is a data question, which drives the cost of care, which is very pertinent to a CEO, right? The third is, how do you deliver that care? And for the company, for the facility or the hospital or the doctor who's sort of delivering that care, how do you enable that person with the right tools in terms of pre-authorization, in terms of the clinical history, in terms of precision medicine, in terms of the in-depth insights on conditions, or even from a preventive care perspective? How do you sort of understand the condition progression and sort of manage that condition progression? So all these factors are directly related to medical cost, which drives healthcare, right? So at the end of the day, the role of the data and analytics function, in my mind, is sort of the lubricant for the entire business, and it is increasingly becoming the business itself. So that is hopefully some understanding into how the role of the data and analytics function sort of growing in importance to the business side of things from an enterprise perspective.
I guess, as you kind of described it, obviously it seems, a lot of places data in is easy, data out is expensive. It seems within healthcare, while data in is easy potentially, there's a couple of steps of that transformation component that start to get really expensive, so that you can actually produce and have analytics and machine learning sit on top of this data. If that's a big core concern, and I guess hospitals and traditionally are not at the forefront of technology, they're not going to be bleeding edge. Is that something that has to change? Do they start, does the healthcare analytics space, if they want to support the community, do the actual businesses need to start shifting how they view, adopt, embrace these changes, technology? Because obviously there are ways of starting to help us maybe, understand how these data pieces are related, but then systems have to talk to each other, which hasn't happened.
Interoperability is a core concern for the healthcare sector from a long time. That's one. So that's the technology related side of things. So there's a lot of data in, as you mentioned, but that data might reside in different formats with different enterprises. That data has to be exchanged, brought together, and then insights have to be generated very quickly in real time, which is not easy if you're sitting on a mountain and massive amounts of data. So that's the technology part of it, in terms of how do I sort of aggregate, mine, and derive insights from data. The second is, what do you do with, increasingly, you want to go beyond just the core structured data components that you have been dealing with for a long time. When I talk about structured data, in healthcare, for example, it's things like CPT codes, diagnosis codes, HCCs, lot of it, images, X-rays, all that has been very structured in terms of how we sort of get things together. Increasingly, we are sort of reaching the limits of how we can sort of use medical technology to drive clinical outcomes. And increasingly, people are saying, hey, there are social factors, there are behavioral factors which are impacting treatment. right? For example, think about a diabetes patient, right? And he or she has a medication. Now, if that person and that medication needs to be kept in a refrigerator, now, if that person doesn't even have a refrigerator at home to store that medicine, obviously his treatment is going to get affected, right? These are factors which drive outcomes, income, transportation, where you live, what job you hold, your housing, your food, etc. Sometimes food takes priority over treatment, right? So all these factors are increasingly important levers in order to sort of drive outcomes. So these are non-traditional sources of data. So how do you aggregate these non-traditional sources of data, which oftentimes may not be very structured, but how do you get that together and drive that integration with clinical data in order to drive better outcomes? That is increasingly a factor that all of us are trying to solve. And that sort of goes back to the health equity aspects that I was talking about earlier.
Yeah, and I guess it's as you're mentioning that, I was just starting to think how there's mountains of data. Each hospital system. Sometimes you go to a doctor, it belongs to some healthcare, somebody else owns that data, and all of a sudden your information, like you mentioned, is across all these different systems. I guess as you kind of in the space, as each of the systems are modeling and then trying to do the preventative care, they're trying to anticipate and improve your health. It really would seem very obvious that actually shared data would actually benefit each of those companies. I mean, obviously, it's not going to happen. I'm just curious because it seems to me the obvious answer sometimes is you see in the cybersecurity space, a lot of CISOs will talk to each other because they all have a similar issue to deal with, and no one really has a competitive advantage. In the case of healthcare, all these different systems have all these different pieces of data. It seems like as though if they actually shared with each other through community effort, it actually would improve their costs and also help each of the patients in the middle.
Yeah, absolutely. And, sometimes I guess it's the industry itself which gets in its own way. Um, there have been very noble and very honest efforts made, and increasingly we're walking that path. I mean, HIEs or healthcare information exchanges actually sort of collate a lot of this information and sort of disseminate it across the board. Now there are companies which sort of actually sit on top of that data and help you understand that data, right? Etc. But a key component of this is that a lot of it is retrospective, right? In terms of, hey, this has happened, right? And then, oh, somebody has got admitted to a hospital and your member is here now. And then you've got to take care of that person. The key question is, how can you sort of use this data by putting it together and use it to sort of prevent something from happening? So that is the big challenge for healthcare. And how do you sort of use all the levers at your disposal, that is just medical data, but also some of the other factors that I mentioned, social, behavioral, etc., to actually, drive that preventive sort of effort? To my mind, that's sort of the challenge. We are increasingly trying to drive interoperability. A lot of improvements have been made from a technology perspective. FHIR, is now in place. The government is increasingly moving to encouraging, incentivizing interoperability. A lot of applications are also driving availability and API driven connectivity so that they are able to sort of connect across the board, etc. But it still feels as if we've got so much more to go. We're solving yesterday's problem, and today, there's much more on the horizon, and we have to speed up our efforts to get there.
I guess if you're CEO of a company that provides this service, if you're looking at the industry and you're looking at and hearing, AI, and data is at the core of that, how do you think that these healthcare systems will start embracing at a faster rate that interoperability? Because if you don't line up the data, the AI really can't help you to be that preventative, to be forward thinking, to be able to detect things that a set of eyes can't potentially read or see, or connect these social issues that are potentially too hard to connect. Is that happening? Will that happen faster? What's the state of that? Because it seems that could be crucial.
Yeah, I think it sort of happens in phases. You start off with individual use cases. I think it'll all start with productivity related applications in terms of how can you do things faster, quicker, cheaper. Like, for example, say in clinical trials, you'll use data now to sort of effectively identify populations to sort of drive better clinical trials. You'll use data to do better drug development, and AI can help in that by sort of effectively simulating a lot of outcomes, and therefore you can sort of shorten time to think of a faster fail scenario. So that's the way I think a lot of productivity related applications will sort of come into play. And then we'll probably start sort of driving more interconnected efforts and move towards a lot of actual precision medicine, drug delivery, treatment, etc., at the provider's office. That's when we'll see the rubber hitting the road in a very visible fashion. Yeah, and that's typically how these things sort of play out. We'll start off with the isolated successes, and then it sort of grows and grows until we see industry-wide impact. I think one factor, one very interesting data point which came out recently was that, in this country, we've always been worried about Medicare spending dramatically rising over the years. And a very interesting thing happened. And, there was an article in the New York Times recently wherein Medicare spending, overall spending in Medicare has actually stabilized unexpectedly over the past 3 years. Nobody saw that coming. Nobody has been able to explain it. But to a lot of industry insiders, it feels like, hey, we've been putting our shoulder to the wheel from the last, many years now, in terms of using data, in terms of using insights, better technology, interoperability, to squeeze dollars out of the system and improve the patient experience. Looks like a lot of those are now coming into fruition. So to my mind, you've got to sort of push at it and keep at it for quite some time until you're sort of able to sort of see efforts. We'll see some green shoots. We are already seeing some green shoots, and I think, this will get better and better over time.
I love it. I think everyone would like to see care improve and costs go down. I think it's a win for everyone.
That's great.
There we go. I wanted to ask you, you obviously have moved from a chief data analytics officer role to the CEO of Althea.ai. I guess that's an interesting journey, right? I think a lot of people in technology want to make that shift. And I mentioned to you, I think that'd be of interest to kind of touch on. I guess to kind of take a step back, as the chief data analytics officer, maybe provide some context. You obviously had a seat at the table. You have the business, questions, critical business questions you're answering. How is that as a training ground for being a CEO? Because obviously there's a lot of people in that role that have an eye to the CEO because they feel they understand the business well. What does that step look like? And maybe talk about, as you kind of going down this path, what are some gaps that you need to work on to kind of round out or have been rounding out through the time of, taking this role as CEO?
Absolutely. So as I mentioned, data and analytics is increasingly becoming part of the business. And people who sort of view the CDAO role as sort of a business enabler are the people who sort of succeed in that role. So it's sort of like a bridge between technology and the business. And unless you and if you want to sort of go more into business, drive business outcomes, then you've got to sort of mold and shape yourself in that fashion. The second thing for me is that, even though I've been a data and analytic professional, I've been in the space of setting up businesses, setting up business units focused on data analytics within large corporations for most of my career. So that has helped me tremendously from having a P&L focus towards businesses in terms of looking at not just individual projects, not just individual technology outcomes, but also how these sort of move business outcomes for my customers. So having that customer orientation, having that P&L orientation in terms of budget management, cost management, etc., being able to sort of set targets for your business, being able to sort of define new products, see how customer behavior is changing, and therefore how your business sort of should mold itself to customer requirements. That has always been a central thesis of my career as I sort of grew up. So that sort of was the impetus for me to sort of develop as not just a data and analytics professional, but also transition into the business side of things, but always sticking to healthcare technology, healthcare data, and analytics. So I look at this as much more of deepening my interest in the sector, but at the same time, being able to drive better outcomes for all stakeholders at the table. These could be shareholders, these could be employees, these could be customers. So that's the way I look at it.
Absolutely. And I guess as your career has been moving away from technology and over time, and now actually it's even one layer now removed from the technology. Somebody else will be responsible for that. How do you see yourself evolving and not having that more of that pure data analytics focus, even though it's been P&L, but obviously when you're responsible for that world, it's slightly different. Are you going to miss it? Is it something that you're going to keep your eye on as a CEO?
Yeah, absolutely. You can never remove yourself from a ground level view of how your product and your service is being utilized by your stakeholders. So that is a death knell for a CEO or anybody who's sort of running a business. And that's been my approach in terms of know what you're selling, know what is coming up from a stakeholder, from a customer perspective. So that's been a central thesis. I don't think that's going to change. It is a healthcare analytics business, so it makes it much, much easier. So that's where I'll be focused.
I like it. Yeah, I think it's interesting because I think a lot of people who our CIO, CDAO, they look at the other side. Sometimes you see finance people move into, CEO roles, you see, operations people. And I think it's a growing trend, especially being an analytics company, to have that technology background and take that leadership position. If you were, providing some just feedback to somebody who's listening, going, hey, I'd like to maybe take that opportunity, move into into that role and manage a larger scope of stakeholders. Are there things that while somebody's at a job, they should start to look or build upon those skills to kind of help that transition?
Yes. As I said, if especially in a data and analytics sort of role, and that's the role that I can speak best to because I've sort of traversed that journey, ensure you sort of are connected to the business application side of things along with the core technology. Understanding how data and analytics and your various applications are implemented and inserted into the business is very critical. Being able to speak the language of the business is very, very critical. So that's sort of the first thing. The second thing is, from a business perspective, I think being able to sort of take calculated risks in how you sort of develop your career is very important. Not being satisfied with the status quo, right? So once you sort of reach a level wherein you've sort of achieved what you could have, being aspirational for sort of the next thing and being in that constant learning mode, I think is very, very critical. As long as you have that hunger to learn, hunger to expose yourself to unfamiliar situations and take on a reasonable amount of challenge, I think that's critical to sort of drive that next level movement into a more business oriented role. That's what people like to see. And that's what's driven me so far, right? and growing teams. I think 25 years back when I started off, analytics was not even a thing. We were solving, math problems for stakeholders. And, they said, hey, this is, you guys do this really well. Can you sort of do this for a living if we fund you? And that's how it all started. And, in 5-10 years, big data became a buzzword and analytics became a thing, etc. And our career sort of grew. But my core thesis was, hey, this drives value for people, and increasingly it sort of drives business outcomes. Therefore, it's a great field to be in, and that's the way I've sort of looked at it. And my chosen field of healthcare, the value that this drives is incomparable. From saving lives and driving outcomes perspective. That's how I sort of view the journey from a data and analytics professional to sort of leading that function to being a CEO.
Yeah, I think that's great. I think anyone who's listening to that's even outside of analytics, I think that describes how you can make those progressions into the high levels of management, that delivering that business value, the better business outcome. I think everyone is always looking for someone that can be an operator and deliver. And I think you kind of summarize that really well. Prashanth, thanks for coming on. Thanks for sharing. Super awesome to kind of listen to your journey, your views on analytics. Thank you for your time.
Yeah, absolutely. Thanks so much. I had fun talking to you, and wish all your listeners the very best.
Absolutely. That's it for the episode. We'll be back again, different guest, different topic. Until then, a couple things. One, if you like the episode, share it with somebody else that also might enjoy it. That's how the podcast has grown. So I appreciate everyone who does that every week. And also, subscribe, comment, drop me a line. Let me know what I can do to improve. If there's topics you want to listen to, let me know. I'd like to see if I can round out more topics for people. Until next time, thank you and goodbye.